Everybody, thank you, Dominic. All right, you just heard a lot of information. We're happy to take questions. If it's not to me, just address it to somebody else, and we'll make sure they get up here to the microphone. So the question is, how did this fraud start? I mean, I think it's been going on for a very long time. And by the way, the Department of Justice has prosecuted fraud cases for decades. This isn't a new thing we're doing. But what we realized over the past several years, there were certain jurisdictions, including Minnesota, where the compliance was so lax or non-existent that you could literally just steal millions and millions of dollars with nobody even checking, with nobody even investigating. And so when you talk about what Dr. Oz was talking about just stopping the flow of money, that's different than a criminal prosecution. That's a very basic step to say, wait a second, we're not supposed to be giving you money, putting aside whether you're committing a crime or not. And that wasn't happening. And you talk about what the SBA is doing. It's the same idea. There's compliance that we can put in place, but that we expect states to put in place. And so so this has been we call it a war, and it is. We call it a crisis, and it is a crisis because it's your money. Right? It's our money. The generosity of the American taxpayer is going out to just pure thievery. And so I don't think it's fair to blame a particular jurisdiction for the inception of the fraud, but there are certain jurisdictions like Minnesota that we have focused on, and now we're in Ohio, and it's happening in California and New York and other jurisdictions, but we need state partners like Ohio to say it's not, well, we're gonna do our own work to stop the fraud, and that's what we're hoping that being here today motivates other states to follow this lead.
Something that we hear all the time, I'm sure you guys do also, is people want their money back. Can you speak to how difficult that is, and also about Officer Favors emphasizing prevention because it's so much better than the front end? I know this is a two-pronged approach as purposes, but maybe you can address about the money and about the payment.
It's a great question. If there is a 5-year fraud that we charge, and we, like you just heard from our U.S. attorneys, we're getting cars, we're getting jewelry, we're getting homes, we're getting cash, but we're catching it at the end. Obviously, money is spent along the way. We're not going to be able to recover everything, and it is has to be a priority, and it is a priority to when we go after somebody to make sure we do everything we can to get their ill-gotten gains. It again goes back to what Dr. Oz was talking about, though. Stop giving them money. Right, so when we turn off the funds because either states or we know that whether it's a center, whether it's a program, whether it's a hospital, whether it's an individual is not qualified, that also stops the flow of money. But it is our mission, and you heard about it today in the forfeiture proceedings that are happening, to not only arrest the bad guy, but also to get every single dime that they made off of this, because we have to create a disincentive that should not be worth it for these guys to do what they're doing. And until very recently, this was a phenomenal opportunity if you were a criminal. It was unchecked, the money was unlimited, and you could go, like you heard, you can go and buy houses, buy cars, and so that's what we're stopping. Yeah, sure. Dr. Oz, want to answer that one?
We are definitely suspending payments. I'll give you one example outside of Ohio that I'll come here. 1/3 of all hospices in the entire nation, and again, hospice is a program developed 40 years ago for people at the end of their life, dying of cancer, for example, just to give them a few months of dignity. So you give up your Medicare to get hospice, a lot of money transfers when that happens. Of the 1/3 of all the hospices that are in California, in the entire nation, actually it's just in Los Angeles, we have now suspended payments to almost half. Now, a few of these hospices have written AI-generated complaints, A few have generated legitimate complaints, but if we have 24 hospices that we need to turn back on again, and we've shut down, let's say, 900, that's a fairly good hit rate. And so the goal here in Ohio, and the same thing that the MFUCOs, the Medicare Fraud Control Unit here is doing, as well as our U.S. attorneys, is to look around and say, okay, where are the places where there's clear aberrations in spending? If 1/3 of all home health care is in this county, then it makes sense to suspend folks in this county, and we did that today, and we're going to continue to do that together with your local law enforcement. The Office of Inspector General takes this seriously as well. As Acting Attorney General Blanche said, we have the opportunity to claw back money, but I liken this much more to what happened with illegal immigration. Once people have come across the border, and more than 10 million did, it's very hard to get them back out again. But if you never let the border be porous, you don't have that problem. This administration under President Trump very clearly demonstrated it was just an act of desire. If you put your mind to it, you can do it. We don't have illegal immigration right now, thanks to federal enforcement of those laws. The same thing could happen in healthcare if we put our mind to it. We control our destiny. It is up to us.
The other thing that's important to note, these frauds are pretty simplistic, unfortunately. So when Dr. Oz talks about doing the analysis on these hospices, you can tell by the data which ones are legitimate. And it's true, maybe you're wrong every once in a while, but the massive amounts, when you have a particular hospice earning, $30,000 a month and another one earning $300,000, and they're the same size, there's something's not right there. So, what? Well, I'm not going to speak to what state officials here have said. I can only tell you about what we see and the results that we react to. What Colin talked about earlier about needing federal and state to work together in every state. When we had the opportunity to come here, when we saw the results that were happening here, we showed up here as opposed to anywhere else because of what we're seeing out of the Attorney General's office, state and local partners. We signed an MOU this morning that's going to allow us to share data. So I guess a local politician can talk, but then we can have people that actually do and act, and I'll take the do and act over just somebody talking any day. Yeah, go back. In the very back, yes.
Thank you, Acting Attorney General Blanche. I have a specific question about whistleblowers that are terrified of talking about fraud and reporting it. In the state of Ohio, several of them, almost a year ago, had evidence of widespread fraud, came to me in December because their offices, like the AG's office, that would not provide protection. This was exposed in terms of millions of dollars of fraud, including providers billing. What can we do to strengthen that, to make sure that whistleblowers can come to state agencies because we don't have strong protections here? And then what can we do for better access for these public records? Because it's been 5 months since Ohioans have yet to see how much we're spending on home health care services, and that's a direct block from the governor's office. So what can the feds do to give us transparency? Because that's really what Ohioans are demanding today.
So I think that when it comes to data sharing, transparency, access to records, sharing information, right? So it's one thing if a state agency has it, and it's another thing if that information actually gets to the right state partner or the right inspector general or federal partner. We cannot win this fight against fraudsters unless we work together. And by we, I mean all the federal partners. Like that means the Department of Justice working with the folks on this stage. It means the Department of Justice working with AG's offices. And so anytime you have anybody along that important path that stands up and says, we're not going to do it, or we have an objection, we're not going to share information, it makes it more difficult. We're seeing that in Minnesota. You have the governor of Minnesota happily say they were cooperating with us when we were executing dozens of enforcement actions around the state. When the truth is, he's suing us. He's not cooperating with us, okay? And so you can actually talk and say things like we'll cooperate, or you can do things like cooperate. And so again, going back to the question earlier, the reason why we're here is not because of talk and not because of what some politician says, but what is actually happening here. And so that's what look, Colin said it, and it's true. We will work with anybody. Director Cash said the same thing. If you have information, tell us, and we'll work with it. So, other questions? Second row, orange.
You suggested that these schemes were previously ignored by previous administration. How often are these providers audited, and how is that process changing?
Well, I think I can let the individuals speak to that about how often. It depends on the program. It depends on the state agency. We put a lot of trust in state governments to do the compliance and the auditing. Some states do a great job. You just heard about Hawaii. And by the way, we pay for it. You pay for it. Our tax dollars pay for it. So when we ask a state to spend the taxpayers' dollars wisely, we give them the tools to do so, financially and otherwise. And when we say that that the last administration was asleep at the wheel, it's because they were just letting it happen at these state levels. So when you talk about what Ferguson talked about, hey, we are going to send letters to every state saying you're on notice. That's what we should be doing. That's our job, to say we're giving you money. We want to make sure you're spending it the way you're supposed to be spending it. And if you're not, we're going to stop giving you money. We're going to decertify you, and you're going to have to come back and earn it. So we're reflecting on the very bad things that happened for many years, but we're done with it. We have a task force, we're focused on it every day, and we're moving forward, and we're already seeing extraordinary results in just over a month, 2 months, and the results I fully expect we'll continue to see. Go ahead. So yes, obviously I'm honored and humbled that the president indicated he was going to nominate me today. I was with him last night at the dinner when he said that. I was confirmed a year ago to be the Deputy Attorney General. I still am the Deputy Attorney General. I will work with the senators. I have a good relationship with the Senate of both sides. I don't say no to phone calls. I'll meet with anybody that wants to meet with me. And I think the work that this department has been doing since President Trump took office, if you look at any stat across the board, it's much better. We're much safer. Our communities are better off. Drugs are coming off the streets, and that's what President Trump expects, and that's frankly what I think everybody in this country expects. So I'm looking forward to working with the senators and getting them the information they need through the confirmation process. Last question. Yeah. I mean, I can let others speak to that, but don't worry. I mean, the American people, the American government is extremely generous, and we want to help those among us that need financial help or services. That's why we have these programs. They're good programs. Nobody up here has said that having programs to help families with autistic children is a bad thing. So if you are a parent or somebody who works or runs a center that's doing the right thing, you ought not worry, because what we're doing is actually protecting you. What we're doing by going after the people that are taking advantage of the money and the programs that Congress has put in place and that the president fully supports, is we are making sure that the money goes to the right people. So I don't know if that's true. I think that people that are doing the right thing and parents that are doing the right thing and businesses that are doing the right thing are not worried. They're sleeping well at night because they know that we're not targeting them. We're not targeting people that are doing it right. We're targeting the criminals that are doing it wrong. Okay. All right. I want to thank everybody for coming today. Again, as we end, I want to thank the people on the first row and the second row here. This is a good day for Ohio, even though we're talking about crimes and fraud and stopping it. And so thanks to our partners and thank everybody for being here today. Thank you.